So I'm Dr. Lars Kensmark. I'm a family doctor for the last 20 years and living and working in a town called Faaborg. So in the clinic we are 3 doctors and about 5,000 patients. The very interesting thing with the system is that it makes that the doctor don't have to use time for sitting at the keyboard and looking in the screen. Everybody knows to be at the doctor, and the doctor is looking at the screen all the time. But as a patient, you need personal contact. Everybody knows that.
Right, yeah.
And with our system, the doctors don't have to type on the keyboard. He or she doesn't have to look at the screen. Everything is served, the data is taken out, and when the consultation finishes, the record can make it itself as I show you.
Yes.
And so now the doctor can concentrate about the contact and the conversation with the patients. In fact, it has been funny to see the last 10 or 20 years that it's been normal that the healthcare person is using a lot of time at the computer. But who says it has to be like that?
No.
We just accept that that's how it is, and that's how it will be the next 100 years. But it's not being like that the next 100 years. With our software, we can always, with our software, which is for free, the doctor can now go away from the screen, go away from the computer, and concentrate about the consultation. And we also think that it makes it easier for the doctor to be a better doctor for the patient. If we can get the screen and the keyboard more in the background, more away from the consultation. It can also make a deep dive into the information in the patient record. So if we talk about your knee, our software will show, the people's doctor will show you the history of your knee the last 10 years. You know, before the consultation, you very often use time for looking into the record. The records are so long, so big today that no doctors can remember very much at all from and so you have to, find information, and because there's so much information today, but with our software, it can take out
exactly what you need at the moment.
Exactly, yes, and so that's also giving the doctor more time to be with the patients and not looking. So I often call it, our service is that we are going from the keyboard to no board. That's our slogan, because in fact this is a tool. It's a okay tool, but it's a tool. In fact, we want to go away again, literally, so we can get free hands again to be a person to a person, or a doctor to a patient. So it's from keyboard to no board, and we are very, very more close to that than most people think. And even these records the system make are records which most doctors can't make themselves.
Accurate and precise.
It's very accurate and very precise. Of course, the doctor should look at the record and should see if the record is good, and before he says it's okay. And there's always be a doctor behind all the kind of decisions which is taken. Like if you're going by airplane, there's a pilot in the seat. You need that. but he has a computer beside of him, and the computer is very good at driving an airplane.
Yeah.
But
should be there.
But the pilot, he decides, and that should always be like that.
Yeah.
It can't. The artificial intelligence in people's doctor should never take over for the doctor. That's not what we like.
No.
But we guess that it will be like that. So that the artificial intelligence won't, push away the doctor, not at all. But the doctors who use artificial intelligence will be better doctors than doctors who don't use it.